happy birthday, man.
Yeah, thanks, boys.
Excellent, Sam. Happy 21st.
Big 2-1.
Sweet.
Sammy was just such a living life sort of person.
I hope you bought my undies, Mum.
He was going to make it places in life.
Overconfident, very cocky. He was always keen to do better than everyone else. And usually he did.
Oh, that was sick. All right?
That was awesome, mate.
Nice job, man.
The day Sam had his strokes on Valentine's Day 2010, the prognosis was that he wouldn't live, but that if he did, he would be a vegetable.
As a partner, it's so traumatic. You grasp onto anything and any little tiny bit of hope, thinking that this will be it, because you want your person back. You want them to be the same person they were before.
We are very much a researching family that simply never gave up, would not accept no for an answer. We wanted the miracle outcome.
By nature, I'm not a risk taker. But for Sam, as a mother who loves him, brought him into the world, what am I prepared to do for him? Yes, I am prepared to take risks in these circumstances. Thank God I did it. And thank God as a family, we did it together.
I remember the first time I met Sam. I was at uni and I was walking across the grounds and Sam was walking towards me and I just stood there in awe of this guy who was so handsome. He winked and that was it. I knew that was my person.
Here we are in our little tuk-tuk.
Sam had played the field a bit, but when she came along, we were convinced that she was the right person for him. And we fell in love with the two, I've got to tell you.
We planned to get married on May 8th, 2010, which would have been our 4-year anniversary.
We'd just been to the venue and finalised all the wedding plans, and Sal and Sam were so excited. And it was almost probably a week later that Sam had his accident.
Sam was playing in a charity soccer match for his work as an accountant. And it was about midday when I got a call from Sam saying he didn't feel too well. When I arrived at the soccer field, Sam was actually screaming at the top of his lungs and he was rocking back and forward saying, "My head's going to explode, my head's going to explode," the whole time. And that's when we knew it was really serious.
When Sam first came in, he had a sudden loss of consciousness. Because he was so deeply unconscious, we were quite pessimistic about his outcome.
We were told that he'd had 2 massive strokes. They said all of the intellectual cortexes of the brain were total white, what they call infarcts, which is total damage. And they also said that the occipital part, which is the vision part, was also wiped out. Sam's strokes, in fact, were caused by chronic dehydration. He was born with cystic fibrosis, and so dehydration is a very common ailment.
The doctors themselves didn't know why he made it through at times. They didn't know. They just said why he's holding on, why he's there, and we just said, it's Sam.
When Sam was in the deepest of comas, and the advice we had was, look, nothing will get through to him, my wife and I saw Sal go up to his bed one day, give him a kiss and a cuddle, looked up the monitor and the blood pressure monitor spiked up, the heart rate monitor spiked up, and I think it was probably from that time on that we started getting more response from him.
To move your head over to where you can hear this noise. Move your head all the way over.
He took weeks and weeks to wake out above the coma, and then he slowly started to respond, but the responses were agonised.
Okay, have some nice deep
Doctors continuously told us that he'd be brain damaged and said he'd never walk, he'd never breathe on his own, and I challenged it every step of the way.
Good job. That's excellent, Sam.
She walked into the hospital one day and the social worker pulled her aside and said, Sally, don't get me wrong with what I'm going to say, but it is my job to tell you to not be afraid to walk away from Sam. You also have a life to live.
I started thinking, what would I do if this was it for the next 40, 50 years and he can't talk and we don't know 100% that he's in there? What am I going to do? Should I give up my hopes and dreams of having children and having a nice life?
Go, Sam.
And then I started to think that Sam's going to be missing out on all those things as well, so why not miss out on all of them together?
We have always believed as a family and with Sal that Sam's brain is not nearly as damaged as they have told us many times. We're looking for the miracle cure. Let's face it, you're a parent, you're grasping.
Sal and I came across this sleeping tablet called Stilnox and how it was having a different reaction on brain injury victims to people simply wanting to sleep. We found that it had been first discovered with a brain injured patient in South Africa with a family member who was sick of the groaning one night and gave the person a Stilnox sleeping tablet just to try and, I suppose, shut them up. This is someone who'd been gone for years. Moments later, that person's talking and conversing and sounding quite intelligent. So we started talking to the doctors about it and we got a very negative view. They just couldn't see it helping Sam, and there's no doubt they were also a little bit risk averse too.
We found out it had a pretty bad reputation. A lot of people had some incidents of sleepwalking and harming themselves and other people while on the drug. So we were a little bit cautious, but we knew it was time to start taking some responsible risks in Sam's recovery. We needed a prescription for it, and none of the doctors would give us a prescription for Sam. So I'm just going to take him to the toilet before I give him the drug.
After obsessive and constant nagging from Sal and Leslie and I, we got agreement to trial him on Stilnox about 3 weeks ago.
So this is the drug called Stilnox, which we used to give Sam, and it states on the back to give him 10 milligrams, which is 1 tablet. The first day we noticed a huge increase in his alertness, his responses when he moved, but no speech at all. And then after about 6 or 7 days, I thought, what's the point of not trying more? What's the worst that can happen? He's already had a stroke. What's the point of not trying a little bit more? So I gave him 15 milligrams. So what I'm going to do now is I'm going to give Sam the drug. So it just like clips on. So we just put it in with a little bit of water and make sure it goes all the way down. So Sam's now had the drug and it's exactly 2 o'clock. And I sat there with great trepidation thinking this is going to go one of 2 ways. He's either going to be okay or it's not going to work and something terrible could happen. What do you want to eat? Weet-Bix. So over about 15 or 20 minutes I was watching him and slowly his face just started to relax. Come on, we can have a hug. Biggest smile I've seen since he's been sick, and he'd giggle and laugh. He thinks he's very funny. I'm just a big feeding cow that comes along and just cooks all day, aren't I? And then he just started joining in our conversation. It was amazing.
Hi, mate. How are you?
How are you?
That's good. What have you been doing? Not much, eh? You've been having a bit of a sleep?
What are you doing, Sam?
I'm talking.
You are talking, aren't you? How do you feel?
Right.
You feel great, don't you?
I feel good.
What have you been thinking in your mind the whole time for 15 months that you couldn't talk? What was the one thing that you thought, if I can talk again, I'll say it?
I love you so much,
Oh, I love you too. One of the first things he said was, let's get married tomorrow. And I said, don't you think that's a little bit quick? And he said, okay, next week. On second thoughts, 2 weeks.
And what's it been like having Sally with you?
Unbelievable. She's my queen. Oh, I'll Queen Sally. Oh, I'll Queen Sally.
It was fantastic. It made me smile on the inside. We had our Sammy back. He was still cheeky and he was still, you know, having a go at everyone and having a laugh, and he was in good spirits about it, and he had a good attitude about it, which means he'll fight all the way to the end.
It's a miracle. For 15 months I was trapped in my body. I could not communicate verbally at all. And now I can.
The joy we felt was just unbelievable. Just unbelievable. I couldn't even start to express it.
I've been blank, I've been in a dark place.
And have you been wanting to talk that whole time, but
Oh,
the words
yeah.
just not coming out?
Oh, yeah. Yeah, most definitely.
Just that first day was enough to know that he's definitely in there and he's fine and he doesn't have brain damage like they've said all along. The muscles in his mouth are so tight that he can't chew without the drug.
I'm really excited about these days.
Do you want another one?
Yes, I love another one.
We get about an hour a day of clear, really solid vocal communication, and then it starts to wear off.
It's very difficult to comprehend the fact that I can talk now, and in an hour or so I won't be able to talk at all. It sucks, it really sucks.
The most frightening time of taking the Stilnox is when it starts to wear off, because you can see Sam's face start to tighten up. You are better now. You've come
You're getting better all the time.
360. His words start to slow down, they become very slurred, and he starts to panic. And he gets very emotional and upset because he doesn't want to lose the ability to talk. And he doesn't want to regress back into feeling trapped inside of his body. So it's painful. It's really painful to watch him go through that after about an hour every day. It's all right. It's all right. Just breathe.
It's very hard to see. It would be like being in a prison that you couldn't make noise from, couldn't move from, couldn't do anything. I think for him it would be torture. Yeah, absolute torture.
Can you use your words and not your signs? At the moment, we are really searching the internet, just looking for someone that can help us. So we really have no guidance at all as to what we should be doing in regards to the drug, if it's safe to give over a long period of time, how much to give, how often. We'll do it all again tomorrow.
Can we have longer? Can we have 2 windows a day? Can we have 2 hours? Is it possible? How will it affect him? How is it affecting his brain?
Over the last decade, basically, I have been working on trying to figure out how this drug works. I'm a nuclear medicine physician by training, and what we do is we do brain SPECT scans. So this is before zolpidem, that's after zolpidem. Quite a clear change. In every brain injury, it seems you have a part of the brain which is destroyed and another part which is suppressed. And what Stilnox or zolpidem does, it reverses the suppressed part of the brain. The brain begins to work again. We published a clinical trial. 23 patients we isolated, and 10 of them showed a response between 10 and 20% improvement in their functioning, some up to 40%. This is, of course, a fairly small clinical trial. We would consider this as a pilot study, but I think we are getting there slowly but surely.
Generally in medicine, we try and practice evidence-based medicine. We will not institute things that we are not comfortable have been adequately tested, and from my understanding, Stilnox is still experimental, and it's fantastic that Sam has responded to it. And not for 1 minute would I suggest that Sam does or doesn't take it. It's out of my domain. I'm not a neurologist, but it is not in the domain of evidence-based practice yet.
What is your vision like?
We're hoping and aiming now for a very full recovery against all odds. That might seem unrealistic to some, but that's the way we are.
Thank you everybody for continuing to support.
If this is the best it is, then we have a great life.
The story went to air in 2011. The reaction was stunning.
An extraordinary story that's brought me here to Brisbane, Australia.
Their loved one was fighting to say, "I'm here."
It was quite incredible to see the response about Stilnox. We had a lot of people contacting us saying they had tried it or they'd heard about it and wanted to try it.
This is 7 milligram dose of Stilnox, and we'll give it to him now, and he should just start talking better in about 15 to 20 minutes, you reckon, Sammy? You reckon?
At that time, the Stilnox was still working really well for him, whereas now it's kind of died off a little bit.
Absolutely hanging for it. I have a huge hit right here, right now. The Sam the man. There you go.
Over the time, as his body got used to it and metabolised it faster, he needed higher doses and the outcomes were less. So his speech wasn't as clear, his eyes didn't sparkle as much, and he would get incredibly frustrated that it wasn't working as much as it used to.
Hunchy. Very good. You hunchied him. Why did you hunchie the doctor? He was what? Ignoring you. So you threw the shoe at him. And that's Sam the man.
It has helped long term, but not to anywhere near the extent that we would have liked it to.
It feels excellent. Excellent.
Which is probably why the family tried any avenue possible to help him in any way.
Sam's journey with cannabis started with a friend, which we didn't know about, give him a joint, and we heard laughing and Sam's speech a bit clearer, and we thought, oh, wow.
I was a bit horrified at first, but then I looked at the effect it had on him. He'd been starting to lose his speech, and it came back.
His eyes sparkled again, his jaw was relaxed, his body was relaxed. He didn't have pain anymore.
The makers of a cannabis-based oral spray for the treatment of multiple sclerosis symptoms say they expect its final UK approval within weeks.
There began a journey to get an approval to get Sam on a drug called Sativex out of the UK, which was a cannabis-based drug. And so we had to jump through some hurdles there. We were then hit literally a brick wall.
We could not get it legally for him, so unfortunately you have to look at options. And those options are friends who can pop by sometimes and help him out.
Did he get a high? Did he feel good? There's no doubt about it, no question. Do I have a guilty conscience about that? Absolutely not.
George is... He's a great dog. He's your dog.
He's your dog, Sam.
As the years went on, I believe Sal hoped that Sam would come back fully. That the reality check is, no, he wasn't going to come back fully.
George.
For me.
Would be...
Frankie.
Frankie, what are you...
Started to itch on our conscience a bit. What's the point in two lives being destroyed? In fact, we struggled with that all the time, and so on conscience we raised it with Sal at one stage, and she wouldn't have a bar of it. She just said, no, I'm staying here for the long haul.
She suffered a stroke 3 years ago, which left this teacher barely able to walk or talk.
And then we saw a program about a new drug called etanercept.
One injection of a drug called etanercept
which was being used successfully in stroke victims in the United States.
Oh my.
She made a full miraculous recovery, and we thought, we've got to try this on Sam.
Woo-hoo! It worked! On me!
Yeah.
Once we saw that, I think we were on a plane within about a week and a half.
Sam's heart lifted, and Sal, we all got excited. We thought, oh, there's hope, there's something else.
We'll have to after the conversation.
Yeah, you're about to have it. Yeah, how happy are you, Sam? You've had to do a lot of walking this morning.
And did a series of etanercept injections, and we hope to see some pretty quick positive outcomes from that.
What do you think about that second shot, Sam? It will work. Let's hope so, eh?
Yeah, free hugs.
We were all convinced that Sam was starting to get some benefits from it, but Sam wasn't. He wanted the miracle outcome, the total cure or nothing at all, and so he was toxic.
And he was very depressed. He just fell into a pretty sad place, to be honest.
It came to a point where Sam's depression and his anger was so strong, and Sal was just totally flat, like flat. And it came to a parting of the ways at that time.
It was mutual. I was his carer more than I was his equal partner, which had frustrations for both of us. But he was also pushing me away a lot. I think he had big dreams for me to get married and have babies and do all those sorts of things. And as I did for myself, I wanted those things equally, and we knew it wasn't going to happen together, but we also didn't want to let go.
When the breakup occurred, I would say in some senses Sal struggled with it more than Sam did. He was racked with sadness for, I'd say, weeks. He came to terms with it. But Sal struggled with finding a way to actually move on with a life.
It was really, really hard not to be with him every day. And I felt like I needed to just take myself away and process things. So I went away for, I think, 5 months. And it was very cathartic. And then I could come back and be in Sam's life in a more positive way.
We caught up with her when she came back. She spoke to John and she said, look, I will always love Sam and I want to visit him every week. And we said, great.
Hey, Sam.
And so Sal continues to do that to this day and will continue to do it until Sam passes.
Hey.
Thank you. That's not very nice. You don't mean to say that to girls, Sammy.
I smell like roses. The situation that we have just meant we couldn't be together. We still love each other incredibly, and I think that will always be there.
You smell like chocolate cake and ice cream. You're welcome.
About June 2015, she said, I'm going to Tasmania for a week. And I said, oh, Sal, that's lovely. And then she looked at me, and then she decided to tell me, because I felt there was someone else in her life, but I wasn't sure, because you don't ask Sal, she tells you, which is fine. And she said, I'm getting engaged. I just gave her a big cuddle. I said, congratulations, I am so happy for you. And she just went, oh.
Phil is a very easygoing, patient, kind-hearted man. He knew right from the start that if he was going to date me, he also got Sam as well and Sam's family. So he got the whole package.
So we met Phil, and Sam just looked at them. He went quiet and he just looked at both of them and said how good they looked together. And I just wanted to cry. I just thought that's the most beautiful thing he could say. It was just lovely.
Sam was amazing about the whole thing, which was an incredible blessing to have. We got married after 10 months of being together. Sam's really funny about it. He's great when he sees Phil, and he always jokes with him like, you stole my woman, and you, Phil. Maybe don't put that in there.
I'm doing
I'm doing
excellently.
That's fantastic to hear. Would you like plum or vanilla custard today?
Sal's still here every week. She takes an active interest in all of his treatment programs. We love her.
No. Obviously, I'm incredibly happy now and I love where I'm at in my life, but it's also very hard to reconcile the feelings with myself that I had a responsibility to him and I had made promises to him. So I felt like I broke that, and I hate to break a promise. So I still feel very guilty about that. Okay, I'm going now. See you later.
She's a fantastic individual who has tried really hard for my brother, and she will always continue to try because she loves him. And that's the way it is. So hats off to Sally Nielsen.
I love you. Currently, right now for Sammy, his Stilnox is working very well. The occasional cannabis from a friend is working similarly. And of course, the etanercept did not show the benefits immediately, but actually now he has greater movement, better balance.
He's showing off.
We actually get speech blurred and slurred speech most of the day.
Sam's probably nearing the end of his journey.
That's my head. Can I keep my head, please?
He's 30 years old, but his lungs started to fail on him about a year ago because of his cystic fibrosis, which is a lung disease primarily.
Now, matey, you are in total control, okay? You pop this one on your mouth. You make sure, matey, now take a huge breath in. You ready?
He has very little oxygen going to his brain.
Squeeze, squeeze, squeeze that little bit more.
He gets very anxious and he gets very hard to handle.
Last little bit and you'll let you off. Well done.
Very, very upset, and it's hard to see. It's hard to cope with.
Josh in charge of your treatment. Does that sound good?
You're terrified.
So Leslie and Josh and I sat down and we made a conscious decision to totally bring his caring to family. And so Josh took on 4 days a week. And what's happened with Joshy is that the most extraordinary vocation has come out. He's just the most wonderful carer.
The laughter is absolutely hilarious. The swearing is unbelievable. I've already apologised to the neighbours because their voices are loud and they're very tolerant and understanding. Josh brings joy and fun to Sam in a way that nobody else can.
It works freaking well. It still works freaking well.
Yeah.
So very, very well. And they're bloody with the cheesy green. I'll swear and carry on like a pork chop. And I'll make him have a great time and make him smile as much as I possibly can because he ain't got much time left and I want him to feel as much joy as he can for the time he has.
You think Joshua is...
excellent care.
Oh, thanks, buddy.
Sam's life has value and has meaning. Every day you find something to make it positive. He fights. He tries his best.
If I have relief when my brother leaves this world, it'll be relief for him that his fight's over and he doesn't have to fight no more. Yeah. Not for us. No. It'll be relief for him. Yeah. Absolutely.